What will it be like when my child gets home from the hospital?
So when you get home, it's going to be a huge relief because you will have passed a major hurdle, both the surgery itself and the initial hospitalization. So take a small moment to celebrate that you've made it so far in terms of the recovery already. The first few weeks after an operation like this, for your child, it'll seem almost like they have the flu, in that their overall energy level, their vigor, their appetite is just not going to be what it normally is. It's very normal for the first few weeks after operation for little things to feel like a big deal, whether that's just getting up to the kitchen and getting a glass of water or the willing up the energy to get up and go to use the bathroom. Those things are initially going to feel like a big deal. As we get further and further out from the operation, those things you'll find get slowly easier and easier. On average, most individuals are able to get back up to their normal self enough that they can get to things like school, or at least starting school in some capacity, by about 4 to 6 weeks after the operation. A full true recovery back to 100% though often takes about a full 6 to 12 months. And that's in part due to the tremendous amount of healing that your body goes through, as well as that recalibration of your body and spine to the areas that you didn't do surgery on.
That's a very good question. So when your child gets home from the hospital, by no means do we expect that they're going to be free of pain or moving around the way that they were before surgery. We simply expect that we're going to have everything and all the tools on board that you or your child will need to control that pain and discomfort, which will get better with time. In general, I tell families that it's our objective to have children off of narcotic pain medications by about 7 to 10 days after surgery, and after that, transition largely to Tylenol as a pain relief medication. We don't want patients who have had a fusion to be on things like ibuprofen or naproxen, because those are anti-inflammatories and can slow the rate of bone healing, which is the primary objective of a fusion in the first place. By 14 days, most patients begin to get their energy levels back and feel much more like themselves, and begin to feel ready to go on errands, for instance, with their parents to the grocery store or Target or other places. And by the time we see kids at 4 to 6 weeks after surgery, they tend to be doing incredibly well. But that's not to say that those first 10 to 14 days can't be hard. Frequently, your kids might be sleeping more often than they usually do. Going through a surgery like this is indeed taxing and tiring and takes a lot out of an individual and takes time to recover from. And then when we treat any of that pain and discomfort with narcotic pain medications, which don't make anyone more awake or alert, it's normal for them to be sleeping a little bit more. But we encourage you to do what you can to allow them to be active, taking walks perhaps a couple times a day, getting up to interact with family for meals and at meal times, perhaps getting up to watch TV in a communal space rather than in their bedroom. Those are objectives you should have. By 2 to 3 weeks, it's my hope that kids are walking, hopefully longer distances. By 6 weeks, we hope that kids can walk at least a mile a day. Finally, another thing I will mention to families is that first 10 to 14 days can be a little bit tumultuous and a little bit stressful. And the reason I say that is dynamics between parents and their kids, myself being a father, are not always smooth. And sometimes teenagers and their parents don't get along famously at all times. And then if you take that and add in a little bit of pain or discomfort, and then narcotics, which tend to disinhibit people a little bit, and keep that all in one small environment, you can expect that there are going to be moments when things might be a little bit combustible, but just know that that will pass. But I'd be lying if I said that at times that experience can't be tough. So you are resilient parents, and I know you can do it and get your child through it. You've gotten them to where they are now. So use the tools you've used thus far throughout your life to get through that period of time.
Likely will be another time of some anxiety. Am I ready to do this? What happens if kind of questions. Hopefully you've answered or gotten answers for those questions already. Your child is strong and young and healthy for the most part and going to do well. They'll have questions and concerns. You'll need to check on them more frequently. They'll need some medication for the first several days or week or two. For the most part, you'll try to get back to a more normal schedule but with short walks, increasing distance walks. You'll likely have to be home from work the first week or two to be taking care of them. At least one of the parents will likely need to be there. But I think you'll find it surprising that after the first week or two, it's like this was a history that happened. And hopefully you took some pictures and you have some remembrances, because some of it will fade very quickly. Hopefully some good parts will remain vivid in your memory. Pictures will help. The first time they stood, they walked, they did things. When you recognized the new shape of their spine, that they're okay and going to be okay. Some of the more uncomfortable things may be having to deal with issues like constipation. And know that even when you're home, the resources for you to contact at Gillette are there. You can call the floor. Most likely, a nurse who took care of your child will be there, who remembers you and can answer your questions, or someone else can. Or you call to the clinic, the support nurse line. You get Danielle or the PAs or your doctor if need be to answer your questions. So when you go home, you are not alone. You're not without the support that has gotten you to that point. Just remember that.